Good afternoon. My name is Elisa Modise. I'm from South Africa. I'm working for Sanka West Rand Clinic. It stands for South African National Council for Alcohol and Drug Dependency. My concern is about our young children in our country who are actually abusing alcohol and it's being socially acceptable. Now, my main concern is that whose responsibility is it? Who is the one who has to actually solve all these problems? Is it the government or is it the private sectors, the NGOs, the treatment centers? Well, yes, they do have a responsibility to solve this problem, but we're actually forgetting one thing. The main important people, the parents, the family. What are they doing about the problem? The people who are actually abusing the alcohol is their children. And remember, we used to have values and norms and standards. What has happened to that? What our parents are saying about that? Is it okay for children to do as they want or what? So my main question here is, we need to go back to our values, to our norms and systems and see if these can be reinstalled in our community. The government is there to provide support, the professionals are there, but charity begins at home. It is the responsibility of the families and the parents to teach their children the right thing. Alcohol is not for children, and it has to start at home. So my main thing is we need to go back and do what we call moral regeneration. And I think if we can do that, somewhere, somehow, we can solve the problem. Thank you.
My name is Ronaldo. I'm from São Paulo, Brazil, and I'm very glad to be here in this conference. I came from this program in Brazil that's called Promude. It's a program designed to address alcoholic and drug-dependent women problems. And I'm here to learn more about harm reduction in alcohol issues. That's it. Thanks.
My name is Modupe Fatokun, a medical doctor from Nigeria. Well, it's been a great conference. I've been learning a lot of new things. I think after this conference, more efforts should be put in by government. There should be a public-private partnership. We should go into schools. I'm more concerned about younger people because they're the ones that abuse alcohol the most. And I'll just like them the public-private connections to educate younger people, go into schools and make people aware of the dangers of alcohol abuse. That's just what I'd like to say.
My name is Dr. Timothy Stamps. I come from Zimbabwe. I don't think things have changed much in the past 25 years. The only issues which have really impressed me is that the alcohol industry now realizes its social responsibility. But government is still schizophrenic on the difference between harm reduction and economic issues on recruiting, taxes and duties. The psychiatric treatment plant used to say 1/3 of people got better, 1/3 of people stayed the same, and 1/3 of people got worse under treatment. And I don't think that has changed either, despite the advances in the drug therapy.
My name is Joyce Perkins. I'm from Nashville, Tennessee. I've also lived in New York most of my life. I work for a faith-based organization in Nashville Metropolitan Interdenominational Church, where we serve people who are 200% below the poverty line with HIV and substance abuse issues. Here at the conference, I just want to say I am so honored with all the work that everybody is doing. My concern is that we bring together the alcohol, the substance abuse, the mental health, the crime, and everything and put it under one continuum. And somehow, despite our governments who are not paying attention to the problem, to do it in spite of the government, to somehow come together as a coalition and just demand that we really need these services, because if we just deal with one issue, it's going to stay one issue. And we have a pan epidemic going on globally. Thank you.